Have you ever been this sad?
Okay. Estoy triste, más triste ahora. Más triste ahora. Sí, nunca he estado, bueno, cuando mataron a mi esposo, estuve más triste.
Okay. Okay. She said, yeah, she's more sad now, ever since she separated from, or she, I guess, left her husband. She's been more sad.
Okay. Does she think this is why she is so sad?
Este es porque tú estás triste?
Sí.
Okay.
Sí, yo creo que sí.
She thinks she's... Okay, she said, I think so.
Okay. Have you talked to anybody about this?
Habla con alguna persona.
¿Con usted?
With you?
Okay.
When we started again, that's when I actually started feeling a connection with you and felt maybe comfortable giving you more information.
Okay.
I think the second part was better. Just even just you looking at me and not at the interpreter helps a lot.
Yeah, it's a very different dynamic.
Yeah,
it is.
But as you said, I think even in a situation where people don't know a lot of the language, you can establish almost like housekeeping. So you can explain to the interpreter, I'm not going to look at you, I'm going to look at the patient. So at least you feel comfortable with how you're doing, because it's not normal.
That's
not
a
to,
good idea,
you know what I mean?
yeah.
And then you can ask them to also establish how are they going to communicate, so that I can focus completely on you. But I didn't do that when I started because I was overwhelmed.
thrown into this position.
I think you did really well in your body language and your expression, and it's you weren't like overly joyful and smiling, because it's frustrating when you're telling something very difficult and personal, and the other person's like, you know. So you kind of matched what I was feeling and kind of kept it neutral, but very personal kind of expression, and I think that was really good. Yeah.
And so in terms of questions though, what feedback do you have?
I thought you had a good selection of questions. Oftentimes when students are told, okay, ask about emotional health, they'll just ask, okay, how's your emotional health, the refugee client? And the client will be like, good, and then that will be the end of it. But you ask, you know, how are you sleeping? Are you getting up in the morning? And I thought those were some of the more specific questions that can give clues about the emotional health.
What is my story? Why am I here in Canada? Why did I leave my country? So I had my whole script memorized and nobody asked me. So I think that that's a really big, really important part of why I'm here in the first place. And it might explain a lot of the whole story actually, because the other group is going to come, right? My husband was murdered in front of me and in front of my little daughter in the farm where I work. And that would already kind of answer a lot of your questions of whether I'm sad, depressed, and all that kind of thing. So just asking a little bit about, tell me a little bit about what brought you to Canada. Like, what were the circumstances that led you to come here, to immigrate to Canada as a refugee or something else? So I think that was definitely, but it's sometimes such a basic question and something that we kind of just skip right next to everything else, but I think a lot of information would be obtained by asking that.
Mr. Izzat.
Mr.
Izzat, and his daughter May. His daughter May, and they're coming for a problem with the lower abdominal pain. It doesn't. That's all that they told the receptionist. And so this is their first visit coming to the family medicine clinic.
And it's her dad.
Yep, Mr. Izzat.
My name is Dr. Lennox. I'm working with the reception house today. So nice to meet you.
I'm Omar.
Omar, nice to meet you.
And she's May. She's
Hi,
my
May.
daughter.
Alexis, nice to meet you. Okay, so Are you going to be interpreting for her?
Yes, she doesn't speak English.
And that's okay with you?
Yeah, it's okay.
Okay, sounds good. Okay, so what brings you in today?
بتقول شو عندك المشكلة؟
المشكلة إنه كل شهر بيبقى في ألم كده من ورا ظهري في النابي وساعات بيجي لي صداع قبلها.
She says like once every few weeks I have some pain in my back, both sides, and some headache.
Okay, when did this start, May?
امتى بدأ عندك المشكلة؟
المشكلة بتاعت الوجع. المشكلة بتاعت الصداع ابتدت من مش عارفة يعني من زمان.
قولي أي حاجة يعني.
من شهر؟
No, it started a month ago.
Okay. Can you describe the pain to me?
بتقول كيف الألم؟ وصفي لي الألم يعني.
من جنابي من ورا ظهري بيوجعني جدا.
I have like severe pain like in my back.
Does it hurt when you do a certain movement?
يعني بيقول الألم بيتغير مع حركتك في البيت؟ No.
Okay, I'm gonna ask questions regards to her being a female. Does this make you feel uncomfortable?
No, it's okay.
It's okay? Okay, so do you notice that it happens around your period?
يعني الألم بيصير عندك كل شهر؟
كل شهر يعني.
She says yes, every month.
Every month. And are you getting a lot of bleeding?
بتقول بيصير عندك يعني نزف كثير يعني دم كثير؟
يعني كتير.
She says it's normal.
It's normal? Okay. Does it make you feel uncomfortable talking about this in front of your dad?
No, she's okay with it, I know.
Are you sure? Did you want to ask her just to check?
بتقول بدك يعني تحكي أكثر بسبب هذا الموضوع يعني؟
هو المشكلة إنه يعني بيجيلي كل شهر وبعدين عندي صحابي بياخدوا حبوب كل مرة لأن أنا جربت أخد أسبرين أخد شاي بس مفيش حاجة بتحصل فصحابي بياخدوا كل شهر نوع من الحب كل يوم وده بيخلي مشكلتهم أحسن بكتير.
She said that I tried to use some aspirin. It didn't help me that much. Some of my friends they use some medication every day, and obviously it helps them.
Okay. How old are you, May?
She's 22.
She's 22. Okay. So how long have you been in Canada?
We are here for 3 years now.
3 years. Okay. And are you living in the reception house, or do you live outside in a house?
No, we have our own place. We live here.
Are you in school?
Yeah, she goes to school every day.
What's your favorite subject in school?
She likes mathematics.
So you said you were taking aspirin?
قلتي بتاخذي اسبرين؟
باخد اسبرين كل مرة لما بيجيلي الوجع بس عشان ساعات بيجيلي صداع بس مش كل مرة بيعمل حاجة.
So whenever I have the headache, I use aspirin, but it doesn't help all the time.
Okay. And you say your friends also take the aspirin, so you do have friends with the same problem?
يعني صحباتك كمان بياخذوا اسبرين؟
لا بياخدوا حاجة تانية كل يوم يعني كل شهر وبيقولوا إن هم ما فيش أي مشاكل.
No, they don't use aspirin. They use something else every day, and they tell me that they don't have any problems like I do.
Are you interested in going on birth control?
No, she doesn't need birth controls.
Birth control can also help with the period, and I think that's what she's referring to. Maybe not specifically for sexual activity.
But I know she doesn't need birth controls.
Okay. Can you ask her if the pill that her friends are taking is called birth control, just so I know what medication she's referring to?
I know her friends, all of her friends. They're all good girls. They don't use any birth control pills.
I think birth control sometimes can be viewed to only be taken when you're having sexual activity, but it also can help with menstrual pain, and I think that's probably what she's referring to, especially if her friends are taking a pill every day. If the pain, I think maybe that's why she's looking to see if there's a pill she can take every day to help her reduce the pain. If her friends are taking a pill every day, it probably is something along the lines of birth control. I know that the name of the pill is kind of scary in terms of sexual activity, but maybe if you can just ask her if that's the pill that she thinks her friends are taking.
Yeah, I'm pretty sure, but I will ask her. So.
Okay, that'd be great.
بتقول صحبات انت عندك صحبات بياخذوا حبوب منع حمل؟
لا ما اعرفش هم حبوب ايه هو بس يعني ممكن.
She doesn't know what the pills
She
are.
doesn't know. Okay. So what do you want to get out of this, our relationship today? What can I help you with? Is it really the pain?
هي بداية يعني.
That's okay.
She thinks yes, she wants help to get rid of the pain.
To get rid of the pain, okay.
You accomplished probably everything you could have accomplished on this visit, but there's maybe an opportunity here to kind of to lay the groundwork, because I thought you already had a bit of a relationship with your patient for another visit, because you think that this is a problem that can be resolved and that there are good treatments, and there's a few good treatments. May could probably help to try to find out the name of the medications. Maybe that might give her a job, and then you might say the next time we'll arrange to have a female interpreter and do the full physical exam as well and things like that. I mean, I don't think you could do. I don't think you can actually solve this problem.
No, maybe what can May do? For example, for the second visit, she can tell the doctor like the name of the medication without saying that this is a birth control pill.
Right.
Yes.
Yeah. Okay.
Yeah,
And maybe I will ask, is it
stigmatized.
like a birth control pill? Maybe
Yeah.
you will not give me the full information for confidential things.
Yeah.
Yeah.
Yeah,
Maybe we
that's-
can
yeah.
do that.
Yeah. You guys said other. To me, that this is like almost a perfect job. I think that one of the issues I find is, like I was just saying next door, that the doctor needs to be the boss because the doctor is responsible for the care that's delivered. And there's often a conflict between an interpreter, who is maybe the kind of the boss of the family, and the doctor. And so I can see this happens quite often. And I'd say that my experience has been now that I can almost always get through that block by addressing this early on and in a respectful way, and recognizing that the quality of the care you provide will only be quality if you can do things the best way possible. This is a situation where, to me, it would be nice to have a policy where we always have trained interpreters that are not having a conflict of interest. I would just have to say that often this situation may arise. I'd like to think that it should never arise for children, but let's say there is a family connection, in which case you should say that visit has a limitation, that it's not a full scope visit. I really don't believe you can get a full scope visit with a family member interpreting. So therefore you just have to pull it into its kind of emergency focus, information gathering, developing the relationship, which I think can still happen. And then you need to be planning the follow-up, and ideally with the appropriate interpreter, in this case a female interpreter, because I do think that female interpreter would play a big role to handle even just, I guess culturally how to deal with this type of problem. Because I already feel a little bit, culturally I'm not sure how an Arabic, I'm not sure the exact ethnic background here even, but how people would manage, because you actually might gain a lot from having an experienced woman who might say, well, these are the kind of things that we often do for this. So it might actually open up treatment options, although it might end up just with the simple pill, but